Colon cancer occupies one of the leading places among all malignant tumors. These are malignant tumors of different parts of the large intestine, colon and rectum, different in form, localization and histological structure. Depending on the severity of the pathological process, 4 stages of colorectal cancer are distinguished. Stage 1. A neoplasm of small size. Located in the thickness of the mucous membrane and submucosal layer of the intestinal wall, there are no metastases. 2. A stage. A large neoplasm. Occupies no more than a semicircle of the intestinal wall, does not extend beyond the intestine, there are no metastases. 2b stage. The size of the tumor corresponds to stage 2a. There are single metastases in the regional lymph nodes. 3a stage. The tumor occupies more than the semicircle of the intestine, grows into the intestinal wall, there are no metastases. 3b stage. The neoplasm can be of different sizes. There are multiple metastases in the regional lymphatic vessels. Stage 4. A tumor of considerable size, grows into neighboring organs. Multiple regional metastases. Tumor of any size with distant metastases. The clinical picture of colorectal cancer depends on the location of the tumor, the stage of development and the nature of the neoplasm. Proctologists separately highlight the signs of colorectal cancer of the right half and left half of the colon. At a consultation with an oncologist, colorectal cancer can be detected by palpation of the abdomen. Most often this applies to tumors of the caecum and ascending colon. Early signs of cancer of the right side of the colon include general symptoms of colorectal cancer and disorders of the gastrointestinal tract without intestinal disorders. In cancer of the left half of the colon, the first signs of the disease are characterized mainly by intestinal disorders, pathological discharge from the rectum, and intestinal obstruction. Diagnosis of colorectal cancer is based on an assessment of the clinical picture, physical examination, laboratory data and instrumental research methods. A special role is given to a thorough history taking to identify factors that may affect the choice of the most optimal treatment tactics. Surveys, general blood analysis, general urine analysis, detailed biochemical blood test, study of the blood coagulation system, definition of oncomarkers, histological examination of the biopsy, examination of stool for occult blood. Methods of instrumental diagnostics are aimed at examining the large intestine and conducting a biopsy for further histological examination. Instrumental research, X-ray diagnostics, ultrasound of the abdominal cavity and retroperitoneal space, osteoscintigraphy, if bone metastases are suspected, CT colonography, colonoscopy, CT scan, chromendoscopy. Other endoscopic diagnostic methods, sigmoidoscopy, narrow-spectrum endoscopy, fluorescent diagnostics. Before planning chemoradiotherapy and before surgical treatment, it is recommended to perform magnetic resonance imaging. The main method of treatment is surgical resection of the intestine with a tumor and lymph node dissection, removal of lymph nodes along the paths of tumor metastasis, in an open way or laparoscopically. In combination with the surgical method, preoperative methods are used: chemotherapy, radiation therapy, chemoradiotherapy. The main objective of this treatment is to reduce the tumor, which ensures greater efficiency of the operation. Postoperative chemotherapy and radiation therapy are carried out when the oncological process spreads beyond the organ, which is determined by a histological examination of the removed preparation. The general principles of surgical treatment of colorectal cancer are radicalism, ablasticity, asepticity and the creation of conditions for the unhindered and natural passage of intestinal contents. In some advanced cases, when tumor removal is impossible, surgical treatment may be symptomatic, the formation of a colostomy with symptoms of intestinal obstruction. Healing control patients who have undergone radical treatment for bowel cancer should definitely undergo regular screening for colorectal cancer. Cancer screening includes physical examination, every 3 to 6 months in the first 2 years and one time in 6 to 12 months up to 5 years, definition of oncomarkers, colonoscopy, after 1, 3, 5 years. Ultrasound examinations, every 6 to 12 months. Computed tomography with intravenous contrast, once, 1 to 1.5 years after surgery. A favorable prognosis for the treatment of malignant tumors. The life expectancy of patients with colon cancer directly depends on the timing of the detection of the disease and the prevalence of the tumor process.